Thank you all for the opportunity today to talk about the big four screening programs that we have in BC. So as Dr. Cricken mentioned, we'll go through the who should screen, what are the screening tests, the when, but we'll focus mostly on the guidelines for those that are at average risk, because that's the majority of people. And with the interest of time too, we don't have more than 15 minutes to go through all the guidelines. And then we'll talk a little bit about where you can get some more information. So again, as Dr. Cricken mentioned, screening is to help prevent cancer, help catch it in its earliest stages before symptoms develop. So if you're experiencing any symptoms, then screening would not be the correct path or the right path to go. And that's because when we're looking for things a little earlier, there are more treatment options and a better chance of recovery. And BC Cancer oversees the 4 screening programs. So those are for breast, cervical, colon, and lung. And what that means is we support things like the reminder letters, making sure the programs are running as they should, facilitating the diagnostic investigation and referrals for that. So we have BC Cancer has your back when it comes to reminding you to go for your screening, but also making sure that you have those referrals to go for diagnostic if your results show that you need that. Before we dive into the details, and Dr. Cricken touched on this already, but a quick test, so true or false, even if my result is normal, I still need to return for screening when I'm due. So, I see a lot of great, awesome, and that's right, so it's true. So screening works best when you're getting regular screens or your routine screens so that then we're monitoring for any changes and we can act upon them as quickly as possible, again, before symptoms appear. The first program we're going to talk about today is breast screening. And before we dive into those details, I'd like to introduce Sharon. She's a breast cancer survivor, and she had shared 2 days after my mammogram, BC Cancer called me. They found out I had a small lump. When my doctor told me that I have breast cancer, I just fell apart. Is this true? But 5 years later, she's going to be cancer-free, and she's so grateful that the mammogram had saved her life. So this is just another example of why my screening is so important. But what exactly is a mammogram? So mammograms are x-rays of your breast done in a private room by a female technologist. We'll take 4 pictures, so 2 of each breast, and look for hidden cancer. Again, it's for people without symptoms and who have never had breast cancer. Screening mammograms are available to people for women ages 40 years and older without symptoms. As Dr. Cricken mentioned, those at higher risk may start screening earlier. So again, those guidelines are different for those at higher risk. But mammograms are also available for many two-spirit, transgender, and gender diverse individuals as well. And as Dr. Cricken mentioned as well, so if you have symptoms such as like a new lump or nipple discharge or something just isn't right, then the right thing to do would be to go to a healthcare provider to get that checked out and not go through screening. In terms of how often you need a screening mammogram, that really depends on your age and again, your risk. But for most people, it's every 2 years. But if you have a parent, a child, or even a full sibling who has had breast cancer, then you may need to come back every year instead. So now that you have your mammogram, what can you expect? So then within 3 letters, BC Cancer will mail you a letter with your results and a letter to your healthcare provider as well. If your result shows that additional tests are needed, a diagnostic facility will actually call you to book an appointment. And just remember that this doesn't mean that cancer was found. It just means that they need to take a closer look at a certain spot. And most people who are called for additional tests don't have cancer. So it's really important to go for that diagnostic investigation just to make sure everything is okay. So with all that said, if you're ready to book a mammogram, you can actually do so directly by calling the screening center, and you can find your closest screening center by going to the screeningbc.ca/breast website, and we have a clinic locator. Or you can call our client services program, and they can help you book an appointment. If you've already had screening mammograms and you receive an invite letter from us in the mail, you might see that there's a booking code, so now you can actually go online and book your appointment. So next is cervix screening. As you may have heard, in BC now we have 2 ways to collect a sample for cervical screening. I have one of them with me today, and this goes back to the DIY part. As you may have heard, we now have cervix self-screening, and what this means is that people who are eligible between the ages of 25 to 69 can now collect their own vaginal sample wherever you feel safe and comfortable. So that means you don't need to go see a healthcare provider to get your sample collected. You can just request your kit from us, and then we'll mail it directly to you. And this is what it would look like when you receive it in the mail. So it comes in this nice little folder. On the side, you'll receive a page of instructions with some images. And all you would need to do is take this swab. It almost looks like a COVID swab, but for down there is what some people have described it. And yeah, so this is the cotton swab. There's a red line on the swab. You would just hold it there, and that's how far you would go up. And then rotate inside the vagina for 20 seconds. So it's not going all the way up to the cervix because this swab is looking for high-risk HPV. So it's a very common sexually transmitted virus. Alternatively, you can go back and get a traditional Pap test. So that's when a healthcare provider would collect a cervical sample. And this is ideal for people who don't want to do this. So this is just an option, or they're not able to or ineligible to do the self-screening. And we can talk a little bit about that in a bit. And the Pap test looks for abnormal cell changes. So compared to self-screening, which looks for HPV, which causes cervical cancer, we're actually looking for cell changes with the Pap test. So the changes are already happening. But now the lab also has the ability to look for HPV with the Pap test sample as well. So who should get cervix screening in BC? So anyone with the cervix, including women, two-spirit, transgender, and gender-diverse people between the ages of 25 to 69 who are not experiencing symptoms. So I don't think we can emphasize this enough, but if you're experiencing bleeding after sex or even pain during sex, then in that case, you would want to see a healthcare provider to get those symptoms checked out. We'd also like to share that cervix screening is still something that should happen regularly, even if you've had the HPV vaccine, you've been through menopause, and if you've ever had any sexual contact with another person of any gender, even if you're not sexually active right now. And specifically for cervix self-screening, it's not for everybody, but we don't recommend it for those who are, again, experiencing symptoms. If you're pregnant or using a pessary, in that case, you would want to see a healthcare provider to discuss your cervix screening options. And if you've ever had your cervix removed, such as having a total hysterectomy. And if you're not sure, then it's great to talk to a healthcare provider to see if cervix screening is still needed. And now, how often should we screen? So for most people, again, average risk, if your result is normal after the cervix self-screening or an HPV test, then you can actually come back in 5 years versus the 3 years with the traditional Pap test. So we can wait a little bit longer because the HPV test is more sensitive, so it's better at detecting HPV, meaning you can wait a little bit longer until your next screen. And again, so after you've had your cervix screening, what can you expect? Within about 4 weeks, you can receive your results in the mail or online on Health Gateway. So it's the same app that you would use to check your COVID results or your COVID vaccine. And if your result is abnormal or HPV positive, you may be recommended for a follow-up Pap test. So if you've done the self-screening, we'll tell you to go see a healthcare provider to get that Pap test, or you'll be referred for a colposcopy. And what is a colposcopy? So it's just an exam where we take a closer look at your cervix, and it's just a quick procedure that you would have to do at a hospital, but you don't have to stay overnight, and it may just feel like a small pinch when a tissue sample is taken. And we also wanted to share that if your result comes back HPV positive, that doesn't mean you or your partners had other sexual partners during your relationship. So this is a question that we've received over the last couple months. Again, because HPV is very, very common. Most sexually active people will have HPV at some point in their life. You may have contracted it many, many years ago. So it's something that's around and it's very common. So if you'd like to request your cervix cell screening kit, You can do so again by calling our client services or even going online to our website and completing an online request form. You actually don't need a healthcare provider anymore to be able to request the cervix self-screening kit. If you don't have a provider and your results require follow-up, then we'll connect you with the clinic that can help support you through that process. And I know the patient stories are so important, so we wanted to introduce you all to Christina, who shared, "Cancer's in my family, but I never thought it would affect me. Had I not done the cervical self-screening, I wouldn't have known. I maybe wouldn't have caught it in time, and history repeats. So I changed history. I let it not repeat. I did that. I did the self-screening." So next is colon screening. And in BC, there are 2 ways to collect a sample for colon screening. There are 2 colon screening tests. And going back to that DIY component, there's the FIT test, so the fecal immunochemical test. And I also have a sample of that. So after your provider refers you or provides you with the requisition, you can pick up this FIT test at a lab, a participating lab. And what it looks like is, and this is what you would receive. So you get a Ziploc bag with the instructions and the tissue paper as well as the test itself. And it's just this. And it just collects a sample of your poop because it looks for blood in the poop, which could be a sign of precancer. And the other screening test is a colonoscopy. So that's where you would actually have a healthcare provider insert a mini camera and look inside your colon. And it's recommended for those at higher risk or who have an abnormal FIT result. And who should get colon screening in BC? So anyone between the ages of 50 to 74 who are not experiencing symptoms. So if you have symptoms such as you notice blood in your poop or you've had some changes in your bowel habits, then talk to a healthcare provider because you would want to get those checked out and you wouldn't want to get screening done. And for most people, starts at age 50, but if you're at higher risk, then you may actually be recommended to start screening earlier. So you've had your colon screening done, and now what can you expect? If your FIT result is normal, you'll be recommended to screen with the FIT again in 2 years, and you'll get those results online on Health Gateway, or maybe even your healthcare provider will tell you. But if you require colonoscopy, when you return for screening will depend on your colonoscopy results. So that could be in 3, 5, or 10 years. So your healthcare provider will be able to tell you when you'll have to come back. If you're ready to get colon screening, you can speak with a healthcare provider to see whether a FIT or a colonoscopy is recommended for you. And as expected, so here's Ray. He's a colon cancer survivor. He had an appointment. He says, "I had an appointment with my doctor and he ordered a FIT test. They found blood, so we booked a colonoscopy. I went in, they scoped me. The doctor wrote on a piece of paper, 'Small lesion, looks like cancer.' The lesion was extremely small, very easily operated on. They checked everything and it hadn't spread. So I listened, they caught it early, I'm cancer-free. And his takeaway is to get screened for colon cancer. It will save your life. It saved mine." And finally, the fourth of the big 4 is lung screening. So this is this is the newest cancer screening program that we have in BC. And how lung screening works is that a low-dose CT scan or an LD-CT scan will take detailed images of your lungs. It's a safe and effective way to screen for lung cancer, and it can show more details than a chest X-ray. And our lovely medical imaging team here would be able to be the ones to help facilitate that. And who should get lung screening in BC? So not everybody, or we've been talking over the past couple programs that it's for most screening programs are those for average risk, but for lung screening, it's for people ages 55 to 74 who have ever regularly smoked, who are at high risk for lung cancer. So it's a more specific group, and again, not experiencing lung cancer symptoms. So if someone's experiencing coughing that doesn't go away, or shortness of breath or chest pain that's always felt or gets worse, when they're breathing deeply, then again, they would want to go to a healthcare provider to get those symptoms checked out. So you've had your low-dose CT scan. What next? Within 4 weeks, you'll receive your results in a letter in the mail, again from BC Cancer. And if your result requires further testing, so they need to look at a certain spot more closely, you may be recommended to come back for a follow-up low-dose CT scan in a couple months, or be referred for diagnostic investigations such as a lung biopsy, where they'll take a small sample of your lung tissue and look at it more closely under a microscope. So if you think you might be eligible for lung screening, you can call the lung screening program at the number on the screen. And what will happen is a patient navigator from the program will ask you questions about your smoking and health history, again, so that then they can assess whether you are at high risk for lung cancer. And your answers to those questions will help determine, again, your risk and whether screening is right for you. And finally, here's Shannon, a lung cancer survivor. She said, they removed the cancer, which was the size of a dime. Because of the early detection in the CT scans, they were able to find it at such an early stage that all was required was removing the cancer. I know it's scary. Nobody wants to be told they have cancer. But if it's detected early enough, chances are they can do something about it. And here is just a summary of all the different programs we talked about today, with a breakdown of who should screen, what are the screening tests, and how often do most people get screened. I know it's super busy and it's a lot of information, but if you do want more information, you can always pick up some brochures in the front lobby that covers all of this information. Go to our screeningbc.ca website, which also has links to our YouTube channel where you can actually watch all the different videos of the patient stories that I shared today. And thank you so much.